And you are watching SHIVAY ka Dr. Tushar Ashutosh. Today, we'll be talking about autism, a very common like disease in newly in kids and around 7 crore kids in India are suffering from this disease. So, first of all, we will understand what autism is, and then we will be talking about its treatment, right? And we'll be also discussing how to diagnose autism. Mm, so, autism is basically a disease which is seen in child. In autism, you will see that the child suffering from autism is different from the normal kids, and you will see that the autistic child is not responding, is not connecting to the environment. Means it is the connection which is between uh, the environment, the surrounding, which a kids develops naturally. You'll not see those thing in our autistic child. And you will see that there is lack of total interaction if the case is severe. If the child is severely autistic, then you will see the child is completely cut off from its environment and surroundings. And as a parent, if you want to discover whether your kid is suffering from autism or not, it can be done by uh, observing your kid. Suppose you, after you come from office and you see that your child is not acknowledging it, and your child is not your child is not giving you that attention once you come from mm, once you come from your office, then most probably she can be or he can be autistic. Today and secondly, I'll cover this later to in which I saw a kid. She is around 4 year old, and I saw some symptoms. I'll also be sharing my experience today. So first of all, I'll tell what general symptoms you'll get to see. First is the acknowledgement which parents get from a normal kid. You wouldn't get that acknowledgement from the autistic child. Secondly, you would see that uh, when you ask a kid, right, of somewhat around 2 or 3 year of age, when you ask his or her name, she'll respond very quickly. I mean, she won't hesitate responding. But in this autistic child, in spite of asking her or his name constantly, she'll not be responding to your speech. She won't even respond to your question like what's your name, what's your age. So it is very important that you need to be very aware of the fact that whether your child is giving you that acknowledgement or not, right? So autism is basically the child is not uh, responding to his environment. And why is this happening? This is happening because there's some, in simple words, I'd like to put it in very simple words so that you guys could understand. This is because your child, your there's some there's some wiring mistake. I mean, your neurons are structured in such a way that you naturally, the kids suffering from the autism don't interact with the environment naturally. So these kids are a special child. You don't have to say that the kid is disabled. He's a special child, and you need to be very curious to figure out that whether your child is autistic or not. If you find some symptoms like she's not making that eye contact with her parents, she's not responding to small things uh, to which you ask. So it is a very prominent symptom that your child is suffering from autism. Thirdly, it is very important to understand that autism is not something which can be treated by, I would say, uh, you don't have to enforce anything if your child is suffering from autism. Suppose you don't have to be that strict with your kid if he's suffering from that this symptom, because at the end of the day this disease have no medicine. Many doctors say that his or her kid many doctors say that uh, things can work, and after taking these medicines. So no medicine, very few medicines are there in allopathy which can actually work in autism. And the best way to treat autism is you have to be very much involved with your kid. If you're very much involved with your kid, then the this autism problem can resolve as fast as it can. I mean, the only way and the most effective way at the same time is engage with your kids as much as you can. More the time you give with your kids, better results you'll be getting in the future, right? And the worst part about autism is there's a very narrow margin of age. I mean, till the age of 6 to 7 years, the autistic child has to be treated. He or she has to be given proper care so that she could develop and she could get rid of autism, uh, and she could be normal. So autism is not something which can't be cured, but at the same time it is difficult to cure, right? uh, and now I'll be talking about what are the proper ways to treat this autism. First and the most important thing is that acceptance of this disease. Or in many cases today, as I said, that I'll be sharing one of my experience. I saw a kid today. She is around 4 years old, and the most shocking part for me was that the parents figured out that her kid is suffering from autism at the age of 3, right? uh, and uh, this age to discover autism is very late. I mean, if you are discovering a kid at the age of 3 that your kid is autistic, then you are left with just 3 more years to cure it, right? So first thing is acceptance of autism, that your kid is autistic, right? Second best thing you can do is engage with your kids. Engage with your kids means that spend as much quality time as you can with your kids, right? See, suppose the worst part I've seen in autism is the parents sometimes used to get very irritated of a slow and late response. I've seen many videos. I've never been in touch with such parents, but I've seen many videos where the parents used to tie their autistic child in chains and all. So it is disheartening, but at the same time, if you want to be a good parent to your autistic child, you have to be very generous. You don't have to get irritated at any point of time, and at the same time, the acceptance also has to be there. And engaging, as I said, that engagement with your kid is very important. So what kind of engagement, you could question me? Engagement should be like, you have to be spending some quality time. Now the question should be, what quality time? Quality time means you can play some sort of game where the kid, your kid, could feel that you are not different from her. You are one of, like, you are just one of her form or one of his form. Like, you have to make her feel like you you are not getting irritated with anything, what whatever she's doing. I mean, you have to be happy with whatever she's doing, right? And you just have to make her feel very light when you are involved with your kid, right? So engagement is very important. At the same time, a very big mistake which many parents used to do is therapy thing, right? I've seen many parents, they say that okay, we are giving our kids therapy. So therapy is only good when your kid is enjoying that therapy. Today I saw, as I said, that I saw a kid where she was uh, going through a therapy. I was there when a female was giving that therapy, and the most disheartening part was that therapist was trying to scold that child. I mean, you don't have to get a therapist where she is very strict with her words, where she is very, very harsh with the words. She has to be very friendly. Your kid needs to enjoy that therapy, and the best way to figure it out is, once the therapy is done, ask your kid that your kid is enjoying that therapy or not. This is very important in autism, that the therapy which you are taking, is it it is that therapy being enjoyed by your kid, right? So second best thing is that when you go for therapy, see whether your kid is enjoying that therapy or not, and then like continue that therapy, right? And I said like engagement is very important. Early acceptance of this fact of autism is very important. Thirdly, third best thing is to, you know uh, the therapy has to be very friendly, and the therapy has to be very enjoyable. So uh, and one more thing I would like to add, that the sugar intake in these kids has to be low. Sugar intake in these kids has to be low means, right? uh, like you have to give like something which doesn't contain sugar. Why I'm saying that the sugar intake has to be low, because sugar increase the activity and increase the it leads to hyperactivity, in short, if you would ask me that. So hyperactivity at the end is gonna cost the autistic child. And mm, the the most important point I would like to share, that how to figure out the autistic child. Like how can you figure out your child, or how, if you are doubtful, then how can you find out that your child is autistic or not? It can be, it can be done by uh, proper evaluation of your kid's activity. Ask your kid name, look into her eyes. If she is able to make that eye contact for a particular interval of time, I mean for 30 seconds, like for 1 minute, 30 seconds is very less, for 1 minute and all. If she is making that eye contact with confidence, and if she is acknowledging your presence, or if she is getting in social interaction with the kids around, with your relatives, if she is responding to your words very quickly, then she is not autistic. You don't need to get worried about it. But if she's lacking these these traits, then you need to get worried. I mean, you need to take certain steps to figure out, go to the nearby doctor and get her diagnosed. And uh, one very easy way to uh, figure out that whether your kid is autistic or not. First first try to call your kid name, uh, and see her response, how late she is responding. And then you say that and then use a chocolate and try to call her name. If she responds in the name of chocolate, then this means that there is a strong suspicion of this disease called autism. So these are some common, I would say, symptoms which is very which are very prominent in the autistic kid. Hope you guys enjoyed this video and you got to learn something new from this video. uh, Thank you for watching this video and Har Har Mahadev.